am Misty Morris and I work in the financial aid office.
Hello, I'm Mary Olvera and I work in Trio.
I'm Carol Jones. I also work in Trio.
Ashley Dryden, I also work in Trio.
Tia Harris, also work in Trio.
Good afternoon, everybody. Today's speech is going to be on ultrasound guided intravenous access. Either you or someone you know has had an IV placed before. PIVCs, or peripheral intravenous catheters, are the most common intravenous devices used in the medical field today. IVs allow for quick and effective delivery of medications, fluids, and blood products directly into the patient's bloodstream. You might know someone who says that they're a hard stick, or maybe you've been jabbed one too many times yourself. With the use of ultrasound guidance, this may be a thing of the past. Today I'm going to be sharing with you some information gathered from the National Library of Medicine, the Royal Children's Hospital, Melbourne, and Medscape. Ultrasound-guided IV access is a powerful tool for placing complex IVs and decreasing patient discomfort. Today I'll be sharing with you some of the reasons for using this method instead of just traditional IV placement, covering the procedure and materials needed, and some of the complications that are associated with this process. Let's begin by talking about some of the reasons for doing this instead of just palpating the vein and placing the IV by hand. Now, since 80% of patients in hospitals receive an IV during their stay, it's not really feasible to use an ultrasound machine for every single patient. A well-trained nurse should have no issue sticking a very healthy or very vascular veiny patient with proper training. Any condition, however, that obscures the patient's veins, such as obesity, a history of IV drug use, or hypovolemia or low blood volume, will make IV insertion considerably more difficult. Now that we know when we're going to need to use this method, let's take a look at some of the materials needed as well as proper procedure. Now, the materials needed are going to be very similar to the materials needed for a standard IV, with addition of a few extra ultrasound pieces of equipment. Every nurse or physician is going to prepare a pair of gloves, antiseptic solution for wiping down the insertion site, a tourniquet, and means of inserting and actually inserting the needle and catheter. Use of ultrasound, however, adds a few items to this list, such as the ultrasound machine itself, coupled with a high-frequency linear probe, ultrasound gel, and a towel to wipe away the gel afterwards. Typically, it's also required for at least one person that's certified to perform this procedure to be present. However, this tends to vary by hospital and by state. Now, on this next slide, I've embedded a very short video of the proper procedure. There's also a QR code off to the side if you want to view this on your personal device. If you are not comfortable around needles, please go ahead and avert your eyes as necessary.
This is how we place a peripheral IV with ultrasound. If a patient's veins are too difficult to stick, we'll bring the ultrasound for better visualization. We start by placing a tourniquet proximal to where I'm going to place the catheter and wipe down the area with alcohol to clean it. Then make sure I have the supplies I need ready to go for when I place the catheter. We use the ultrasound probe to start looking for the best vein. Once we find a vessel we like, we press the probe down on the skin to make sure it's a vein, which is collapsible, and not an artery, which has muscular walls and a pulse that you can see on the screen. Now that we found a good vein, we keep the probe perpendicular to the vessel and go in with a needle along the midline of the probe. Here you can see the tip of the needle entering the lumen of the vein for successful placement of the catheter. We make sure it's in the vessel by pulling blood through it with a syringe and pushing it back in. Always put an adhesive over the catheter to make sure it stays in place. And that's how we place a peripheral IV using ultrasound.
Since we've gone over some of the situations requiring ultrasound guidance for IVs, as well as the proper materials and procedure, let's take a look at some of the possible complications that arise from doing this. Now, these complications, like the materials, tend to be very closely associated to the ones applied with a standard IV. However, these complications can go unnoticed for longer or even be complicated because of the sometimes increased depth associated with placement with an ultrasound machine. Puncture of an artery instead of a vein, contact with a nerve, or thrombosis or clot or infiltration are all possible complications that can arise from this. Now on this slide you can see illustrations of these complications like a clot. Here's the catheter needle here, here's a clot, and there's a vein inside here, and here's an infiltration, which might not be really familiar to most. The needle and catheter have completely passed through the vein and is depositing the administered fluid into the interstitial space or the space between tissues. While these are sometimes worsened by the depth, they can also be avoided because of this process. Now, you have a machine that you're able to see through tissues, so you can review this imaging prior to insertion, and proper training as well also helps avoid these complications. As you can see, ultrasound guided IVs are a powerful tool in the placement of complex IVs and can decrease patient discomfort. And we've covered when they can be used, the materials needed, proper procedure, and possible complications. With 150 to 200 million IVs being placed in the United States every single year, we have to take special care and ensure that this process is as painless as possible. Ultrasound-guided intravenous access gives nurses and physicians a powerful tool for minimizing incorrectly sticking a patient or even accidentally causing injury.
How long has this been around, the machine, the process?
I'd have to get back to you on that. I'm sorry.
Thank you.
Any other questions? Anybody wish they had it around, been stuck too many times?
I do.